Imagine if you could capture patient context that happens outside the clinic. Today, we're talking about Horizon, a Copilot for non-clinical context. Clinicians often miss context that would actually help them ask the right questions. With Horizon, we've built a Copilot that actually pulls together patient conversations, whether it be a vendor's call, a chatbot conversation, or possibly other medical images. Through an MCP for health, we're pulling in foundational models that then leverages tool calls to bring in literature and academic evidence that creates the best clinical interpretations of all of that patient data.
All data lives behind a patient's phone and its security. Operations with foundation models will use homomorphic cryptography to ensure privacy. When a patient authorizes, that context is made useful and surfaces directly into a bridge's clinical notes, creating a complete patient profile.
Patients can then click, or physicians can click into their summaries that are pushed out by this Horizon Copilot. When they push in, they'll get the full context landscape. That is shown here.
With a full data story, physicians make better diagnoses and better referrals because they have a better understanding of the patients.
So no data, data is shown.
And so one view we have is a full view of a patient's specific non-clinical context that involves all other interactions that they've had living on their phone. We ask them if we can download it from their phone. Horizon comes in, integrates that information, and starts giving us risk factors for things like strokes, and lets us actually overlay second-order risks from foundation models that tell us things like depression or stroke recovery times or second-order worries that patients can have. The physician can make better decisions with all this context. Something else, 2 minutes, 54.